Hello, I'm Dr. Kyle Ballou. As a podiatrist, hardly a day goes by that I don't get asked about those thick, ugly toenails that so many people have. They prevent you from wearing sandals, or going barefoot, or going to the swimming pool, and people want to know what causes them and what the treatments might be. So I thought I'd take a couple of minutes today to explain some of the more common reasons that you have these types of nails and what treatments are available. Please understand that nails of this type could be indicators of larger, more systemic problems that a person has, such as lichen planus or psoriasis or some of the others. So they need to be evaluated by a doctor. But I thought I would talk about a couple of the more common things that we see that cause nails to become ugly and thick, and some of the treatments that are available for them. Generally, one of three reasons will make a nail appear this way. One is fungus, one is trauma, and one is a combination of the two. In order to properly treat a nail, you have to know what the correct cause of the problem is. So, the proper avenue to take is you see your podiatrist, have a nail clipping taken or a biopsy of the nail, and have it sent away to the lab for analysis. Once the report is returned, we can determine what causes the problem and best come up with a treatment plan for that problem. Let's talk about those just a second. Let's say it comes back as fungus. Well, there are several different kinds of fungus that can cause nails to look this way, so we need to know what type of fungus it is, and the report will tell us that. Some of the fungal causes respond better to an oral medicine, and others might respond best to another type of treatment, such as a laser. And let's say that the report comes back that there's no fungus, that it's trauma. Well, a traumatically induced nail such as that won't respond to an oral medicine or to a laser, but it must be physically treated by trimming the nail back as far as it will go to expose the nail bed, and then some chemicals applied to the nail bed to erode the calloused tissue that's present that will keep the nail from adhering to the nail bed. As the nail grows, hopefully, it will stick to the nail bed and the discoloration and separation will go away and the nail will stick down and have a more normal appearing nail. This is the best way to treat a traumatically induced nail. Keep in mind, the nail can be totally removed and the root can be killed so that the nail never grows back, but that may be a little more drastic and can be considered in the painful, really thick types of nails that are really altering your lifestyle. Now let's say that the report comes back that there is fungus. Well, there are two main reasons that you can use topicals and lasers for certain funguses. Some of the fungus is best treated with the oral medicine, such as a saprophytic mold. The oral medicine generally is taken for 3 months, and there's generally some lab work done at the beginning to see if your liver is functioning well. And then halfway through the medicine regimen, another lab can be taken to ensure that the liver is not having adverse effects to the medicine. Once the 3-month regimen is over, you must wait another 3 months for the nail to grow out completely to determine if you had good results or not. The last way we can go about treating these nails is with a laser. Some lasers have been FDA approved to treat fungal toenails. And in our office we use one called the Novion. The Novion laser works by photoinhibition and doesn't really get hot. Heat ablation is another type of laser, but it is somewhat uncomfortable And so I prefer the photoinhibition style. It uses 2 different wavelengths to kill the fungus at the mitochondrial level and at the cell wall level. Generally, 3 treatments are issued over the course of a 2-month time frame, and then you must wait an additional 4 months to see what success you've had. Sometimes success is better obtained by a combination of the oral medicine and the laser, depending on the number of toenails that are involved and the amount of involvement of each toenail. Once the therapy is completed and the 6 months are gone, if there has been a less than desirable effect, these treatments can be repeated. More biopsies may be necessary to see if something else has arisen, or possibly the nails can be removed. If successful results have been obtained, then you may be happy with just normal maintenance, and your podiatrist can show you how to trim them properly. Generally, the laser treatments have about an 85% success rate. Now, this doesn't mean that 100% of the people are going to get 100% relief and successful treatments. Most of the time it means that most people will get about 85% success, which is about what we see. And then if we want to do more after that, we can, such as the oral medicine or more rounds of the laser. Well, I hope that this has been helpful to you. I hope that you can find the right solution for your problem if you have this problem. It's not an easy one to fix. There's not an exact science just yet on how to treat them, but we are making progress rapidly with each and every passing year that comes by. Thank you for watching my video, and if you need laser treatment or need an evaluation or just a biopsy, give our office a call. We're happy to help you at any time. We'll talk this thing through with you and find out the best exact treatment regimen and tailor it for your specific condition. Thank you.